Hi, my name is Katie Buck. I am the Emergency Services Clinical Nurse Specialist, and I also help work with the stroke team in the emergency department and throughout the hospital. And I just want to share today some important things about stroke for May, which is Stroke Awareness Month. And so the really key piece with stroke is prevention, recognition, and treatment. So with prevention, you really want to focus on the acronym B FAST, which stands for balance, which can include, you're sort of walking differently or you're unbalanced. Maybe you have dizziness. E would be eyes. So that could be some vision loss, some blurred vision, double vision. F is for facial droop. So one side of your face is drooping. A is for arm. So weakness, numbness, tingling in your arm. That can also be in your leg. S is speech. Speech is for slurred speech and maybe having a hard time getting your words out. And then T is time. So T would be where you call 911. That's really the key piece. So when you call 911, here are some things that happen specifically at Carolina East. EMS will assess the patient and figure out when their stroke symptoms started, and they will call the emergency department and notify us that they are bringing a patient with a suspected stroke. And so we will activate our code stroke process, and that includes notifying our CT techs and radiology. So they make one of the CT rooms available for our code stroke patient. We also get a code stroke box that we have that has all kinds of things that we need to treat the patient rapidly. As soon as the ambulance arrives, the patient goes straight to CT before they even go to a room in the emergency department. Once that CT is done, it really just takes a few minutes, and they come to the ER room where the nurses are there ready to start IVs and get them on the cardiac monitor. We have a neurologist see the patient via using telehealth services, which is a great advantage for us to have here. And then those neurologists, along with our ER providers, make the best clinical decision and recommendations for the patient who is experiencing a stroke. And so the next step, if they are eligible to receive TPA, is that the nurses go ahead and mix the TPA, and they work together to make sure that the dosing is all appropriate. And then we administer it as quickly as we can, because as they say, time is brain. So those are sort of the key pieces and what to expect when you come to Carolina East. We do keep here in our ICU, after patients receive TPA, a majority of our patients, which is so key because it's really great to have a good support network after your stroke here, and you get to remain in your community. And then if needed, we have a great rehabilitation hospital that can help you recover from any remaining deficits from your stroke. So I would encourage people to come as soon as they can when they're having stroke-like symptoms. Call 911, which is really key, and come see us right away.